questions around DDRS. Before we get started, want to talk a little bit about how to use live captions. So if you need or want to use live captions, let's see, Heather, if you want to move to the next screen, you can do so by turning on live captions and subtitles. So you'll want to select the captions and subtitles on your video controls. To change the caption language, you can select settings and then caption subtitles and choose the language you want to use. If you have a question, you can put that in the question and answer on the Q&A on the right side of your screen. You just need to type your question into the compose box and then make sure you click send. And then your questions will only be visible to Heather and I, and we'll answer questions as time permits. If we have questions that we are not able to answer during the webinar, we are using those in future webinars. So feel free to, again, note any question you may have. So today we have a similar agenda to what we typically would have in these meetings. We have updates for all providers. We have updates that are more specific for providers of services on the health and wellness and traumatic brain injury waivers, and then updates for providers that provide services on the community integration, habilitation, and family supports waiver. We know that we have providers that provide services on all 4 of those waivers, so stay tuned. And then we will go over, I think we only had 1 or 2 questions from the February webinar, so we'll go over that as well. And then at the end, we will do the typical call for future webinar topics. Again, we do these monthly right now. We are discussing and would appreciate any feedback you may have on the frequency of these webinars. We want them to be meaningful and valuable for you. So any feedback that you may have is appreciated. So again, in February, we started a new format for these meetings or these webinars due to some changes in teams. So we think this is probably working well now. February or January, I think we had some challenges with getting questions and answers, or getting the questions that were submitted. So we think we fixed that in February. So hopefully we're on the right track for today as well. Right. So all provider updates. As a reminder, claims must be submitted for reimbursement, and the services must be rendered prior to submission of the claim. So as an example, if you are a provider that bills on a monthly basis and you're providing structured family caregiving, if you provide structured family caregiving in the month of January, starting January 1st, ending January 31st, your claim can be submitted February 1st, but it could not be submitted in the month of January for January, if that makes sense, if you have not provided all of the services. We are seeing that providers are billing on the 1st of the month prior to rendering the service. So just wanted to put this reminder out there. We know that sometimes there are changes in personnel with providers. So feel free to share this if you have newer staff that do your claims, but those claims should not be submitted until after the service has been provided. Now we have some specific provider updates for the health and wellness and traumatic brain injury waiver providers. That's inclusive of case managers. So when we talk about provider updates, that could be providers of any service, inclusive of case management. So if you are an area agency on aging or aging disability resource center, you have been notified that there were a number of pathways members that were assessed and found to not meet nursing facility level of care prior to February, following completion of a chat by the managed care entity. The new level of care denial letters were mailed to these individuals to ensure that they have appeal rights before any action is taken on their services. To identify letters mailed in this specific scenario, they will include this information at the bottom of the appeal page, the OALP, or Office of Administrative Law Proceedings, nursing facility level of care eligibility denial, and then there will be included a CAMS case ID number. We are receiving appeals from these individuals, or some of these individuals, and are reaching out to the area agencies on aging and independent case managers daily with a list of appeals that are received for each agency. The area agency on aging must reach out to the individual's assigned managed care entity to notify them of the appeal. And then the MCE, or managed care entity, is required to complete a new chat to ensure accuracy. That chat will then be submitted back to the area agency on aging for review and data entry. MCE should be indicating in the email notification on the chat that it is for a level of care denial appeal. The MCEs have 5 days to complete a new chat. So in this scenario, once the AAA, once we receive an appeal, that MCE will have 5 days to complete the new chat once they're notified that an appeal has been launched. If the second chat results in a denial, in this scenario with this particular level of care decisions prior to February, a new face-to-face assessment by the AAA is not required. Next slide. The AAAs should enter those chats done by the MCE as part of that appeal process within 3 days of receiving that chat from the MCE, and then respond to the state's care management team and let us know that the eligibility determination has been completed. So the timelines are being adjusted to meet the requirements of OALP, which is the Office of Administrative Law Proceedings. We understand the increased volume is unexpected, and we appreciate everyone's assistance in ensuring that these assessments are completed correctly and timely to avoid any unnecessary gaps in service for those we support. If you have questions, if you're an area agency on aging or ADRC and you have questions, please feel free to reach out to Kara. I think you all probably know her. Please feel free to reach out to her, and she will get back with you if you have additional questions. All right. Next slide. All right. And this, I believe we talked about, I think it was last month as well, but want to make sure we're getting the word out to all the providers. As, again, a reminder, the medication dispenser install, which the abbreviation is MEDI, and the medication dispenser monitoring, MEDM, billing code is not a separately defined service within the health and wellness pathways or TBI waivers. The medication dispensers are actually covered as specialized medical equipment and supplies. So an individual who needs a medication dispenser needs a request submitted under the specialized medical equipment and supplies, or SMEs, And that is allowable for a medication dispenser only. Monthly monitoring is not allowable under specialized medical equipment and supplies. So effective April 1st, which is next week already, any service plans that currently include or are requesting to add the medication dispenser install or the medication dispenser monitoring will not be approved. Case managers need to zero out the Med-M and request the medication dispenser through the specialized medical equipment and supplies if this is a needed item for an individual. Of course, all specialized medical equipment and supplies requirements will apply, so make sure that if you are submitting a request for a medication dispenser install, that you include all the information as required by that specialized medical equipment and supplies definition. I am getting a message that somebody has lost sound. Heather, can you still hear me?
Yeah, I can hear
Okay.
you, and it doesn't appear anyone else is
Okay.
saying they're having issues.
Okay, good. Sorry for whoever is having sound issues. I apologize for that. All right. Want to talk a little bit about service planning and attendant care. So attendant care, as we know, provides direct hands-on care to participants for the functional needs with ADLs. Skilled care is not allowable under attendant care. If an individual has skilled care needs, it must be documented how the skilled need is being met and by whom. As providers, as case managers, as state staff, we must comply with the service definitions that our federal partners have approved in our waivers. So some services not allowable under attendant care are services provided for a participant regarding specialized feeding, services provided for a participant regarding management of uncontrolled seizures, services provided for a participant regarding management of infusion therapy, injections, wound care, incision care, ostomy care, and tube feedings under the health and wellness and TBI waivers. Also, attendant care does not allow for services to set up and administer medications or services provided to household members other than the participant. Also want to talk about home and community assistance, which is another service pretty frequently used. The Home and Community Assistance Service provides instrumental activities of daily living, or IADLs, for the participant in their home. The services are provided when the individual is unable to meet their needs or when the informal caregiver is unable to perform these needs for the participant. So some of the things that are not allowable under home and community assistance include assistance with eating, bathing, dressing, personal hygiene, medication setup and administration, hands-on and or assisted transportation of participants to community activities or errands, and then again, services provided to household members other than the participant. So again, that HCA, or Home and Community Assistance, or for those of us who've been around for a while, what we used to call homemaker services, those are really focused on IADLs, those instrumental activities of daily living, and not on personal care per se. So everyone's favorite topic, just kidding, service planning and requests for information. A request for information is submitted by the state when there is not enough information for us to render an approval or denial on a plan. We would like, just like everyone on this call, would like to be able to review a service plan and issue an approval or a denial based on that information in that plan. Unfortunately, we're not always able to do that. Examples of some requests that we have, that we see that we submit or send out fairly often, include missing documentation, or the documentation is conflicting with other assessments. Additional information is needed regarding other supports the individual receives, such as education, therapies, perhaps state plan services. We often do RFIs or requests for more information, requesting updates on whether the individual has pursued services through state plan. Again, this would be like home health services. And then we complete requests based on the need for clarification on who is providing support for an individual's skilled care needs when the individual is receiving attendant care. Again, trying to help ensure that we are all abiding by the service definitions of those waiver services, such as attendant care. Removing non-allowable tasks from the daily schedule does not mean that those tasks are not still occurring. So if we do a request for more information, if you're removing, we need a little more than just removing tasks from the daily schedule. So we need to know these tasks were removed because the attendant care does not perform those tasks. And those tasks are being addressed through state plan services, as an example. That is just an example. But please ensure the supports being provided are within the service definition, and support individuals and their families. If they need services that are not available through waiver, we need to be connecting them with other resources, right? State plan, maybe it's other generic community resources, but really taking that holistic approach to supporting individuals and families. All right. So person-centered planning. So this is not a new term for anyone, but a person-centered service plan or person-centered support plan must reflect services and supports that are important for the individual to meet the needs identified through an assessment of functional need, as well as what's important to the individual with regard to preferences for the delivery of such services and supports. So person-centered planning takes into account what's important for someone as well as what's important to someone. And the only way we know that, right, is to talk with that someone and learn what their vision is for their good life, and to do those functional assessments so that we can clearly identify the functional needs for the individual. The person-centered service plan must be commensurate with the level of need of the individual and the scope of services and supports available under the home and community-based services waiver that the individual is currently receiving supports through. It's important that individuals utilize support from families and communities, much like the rest of us, right? Medicaid state plan services and other federal, state, and local public programs prior to utilizing those waiver services. When possible, individuals need to utilize informal supports in addition to formal supports to meet their needs. When someone requires 24/7 care, that does not mean that 24/7 care will be funded through HCBS waiver services. It may be a combination of informal supports, such as family, community supports, state plan services, waiver services. Again, it's that holistic approach to supporting people in their communities and helping or supporting them to be included in that community and able to access everything that someone not receiving home and community-based services can access. Okay. Going to talk a little bit about the waiver transition best practices. So when we talk about the waiver transition best practices, we're going to talk about when people are moving or transitioning from one waiver to another. This today, our discussion is really about the health and wellness waiver, the traumatic brain injury waiver, and the family supports waiver, and movement within those waivers. So transitioning an individual from one waiver to another requires coordination between case managers. So just as an example, if someone is on the health and wellness waiver, transitioning to the family supports waiver as an example, the case manager for the health and wellness waiver and the case manager for the family support waiver need to have strong communication between the two and the teams or the team supporting the individual. And of course, the individual needs to be part of that communication or their legal representative to ensure that there's no any potential cracks are sealed before the transition. Careful coordinated planning ensures that the individual will not have a loss of service or Medicaid if the person requires, for example, the special income limit. Additionally, we want to ensure that the individual is not activated for more than one waiver, because a person cannot have more than one 1915C waiver at a time. So case managers need to work together and with the individual and providers to ensure that if, in my earlier example, the health and wellness waiver ends on 3/31, the family support waiver starts on April 1st, right? Smooth transition. What do we need to do? How do we need to communicate to make sure that transition for the individual is as smooth as possible? And that almost always boils down to communication. Okay, so here's a practice example. Oh, and that's probably why I mentioned it, because this was an example we were talking about. So for an individual transferring from the health and wellness waiver to the family support waiver, and let's just expand on that a little bit. Someone is on the health and wellness waiver, so they meet nursing facility level of care. Let's say at their annual reassessment for level of care, they no longer meet nursing facility level of care, because any of our home and community-based services waiver requires annual reassessment for level of care, whether that's nursing facility level of care or ICFID level of care. So this individual is on the health and wellness waiver, receiving services through the health and wellness waiver. Their level of care is assessed, and they no longer meet nursing facility level of care. There is a process that I believe we talked about last month. The person is assessed if they have an intellectual or developmental disability. We'll say they are assessed by the Bureau of Disability Services. They are eligible for ICFID level of care. Thus, they have access to the family support waiver based on a priority criteria that we added to the family support waiver for individuals who are active on the health and wellness waiver who lose nursing facility level of care. The health and wellness waiver case manager and the family support waiver case manager must coordinate on dates before taking any action on that loss of level of care on the health and wellness. We want to ensure, the case managers need to ensure that the individual and family are in a part of all of that communication so that they have awareness of when that transition will take place. That transition will need to take place if the individual wants to pursue the family support waiver, because they no longer are eligible essentially for the health and wellness waiver. So we need to act as quickly as we can to facilitate that transition. And when I say we, that means case managers, providers, individuals' families, and BEADS, the Bureau of Disability Services, to make sure that we can effectuate that transfer as quickly as possible. The family support waiver would start on April 1. The health and wellness would need to be terminated the day before on March 31st. This way, there is no gap in service. The person seamlessly or smoothly transitions from the health and wellness to the family support waiver. Our priority in these situations is to ensure, to the best of our ability, no gap for individuals. So case managers need to be communicating to facilitate that transition. All right. Now we have some updates for providers and case managers for the community integration habilitation and family supports waiver. Jira tickets. So we continue to receive multiple Jira tickets submitted by case management organizations and providers with the following requests, and we're going to talk through these. Changing the start or end date of a person-centered individualized support plan, or PCISP. It is the responsibility of the case manager and provider to monitor the service authorization and notice of action and to make timely changes if start and end dates are incorrect. So please, what we are asking here is, to try to be more proactive and timely if you need to change dates, as opposed to, and that would eliminate the need for a Jira ticket, right? Living arrangements. If living arrangements are not entered in a timely manner, we are getting Jira tickets on those. So again, a reminder, it is the responsibility of both the case manager and the provider. A living arrangement can be backdated 10 business days, but requests made beyond 10 business days will not be approved. So when a living arrangement changes, the case manager must enter the correct living arrangement. If the provider has not informed the case manager about a change, the living arrangement will not be backdated to the date of the change if it's more than 10 business days. So again, communication is key. Communication among team members is key. And please, as providers and case managers that utilize the BEADS portal, there is quite a bit of visibility there into a person's living arrangement and things. So please act timely. Providers, if there is a living arrangement change, case managers should know about that. And please work to update that timely. We also are seeing Jira tickets requesting adding hours or units retroactively. Units can be added to the current and immediately preceding month of a PCISP. All other requests likely will not be approved. So it is, again, imperative that there is timely communication and follow-up and appropriate action taken if there is a need to move units. We need to be as proactive as possible in those situations. It is certainly allowable to do that, but again, retroactive changes should be limited to the current and immediately preceding month of the PCISP. We're also seeing Jira tickets about PCISP service units and hours were not correctly or timely allocated, and now the case manager cannot update the PCISP. So we need the individualized support team to discuss and review those services and supports on a regular basis. And then the case manager and provider need to monitor that service authorization or notice of action in a timely manner. And then we have, excuse me, you have a little bit of a cold, so apologies. The PCISP has a remaining allocation and an STBR cannot be submitted. So again, this comes back to communication and case managers and providers monitoring those service authorizations and notice of actions to ensure unallocated funds can be applied on the active PCISP. it is not possible to submit an STBR if there are funds available. Next slide. Provider attestations. So, gosh, I think we talk about this every month. So, a provider system administrator must log into the BEADS portal and confirm the provider profile information at a minimum of every 90 days. Providers can go into the BEADS portal and update their provider profile anytime they choose. Every month, every 90 days, less often for updates. Like if an update doesn't need to be made for 6 months, that's okay. However, the provider must attest a minimum of every 90 days that their information is current. So I'm going to talk again about why that's important. Our choice list that comes out of the BEADS portal is what individuals and families use when they are searching for a provider of services. It is critical that individuals and families have accurate and up-to-date information when they are making a choice of a provider. That information is not updated unless providers do that updating. We, as a state, when a provider makes an update, we will facilitate that and make sure that the system reflects that change, but the providers need to go in and make that change. As we're looking at the end of the first quarter of 2025 already, all CIHFS providers are responsible for ensuring their provider profile remains accurate and that the provider attestation is completed. If you're a provider and you need assistance in how to complete the provider attestation or update your provider profile, the BEADS portal in the resource page or resource section has user guides that give very specific information about how to do that. We have the provider completion of the provider attestations is a metric reported to our federal partners. We have not hit target on that metric and have made some changes, as you may recall, by including in the choice list when a provider has last updated their profile, signaling to families so that they know, when the latest information or what providers have the latest information on that profile. We are looking at additional steps that we may need to take to ensure that those attestations are completed. I know we send out reminders. We talk about it every month here. But please, if you are a provider and you are a provider in the BEADS portal, please give us your attention so that we can make sure that individuals and families are getting the most current information possible. Quarterly reports. So each waiver provider is required to submit a quarterly report summarizing the level of support provided to the individual participating in waiver services based upon the identified supports and services in the PCISP. Examples of the required elements of a quarterly report can be found in the day habilitation service definition and standards, as well as the behavior support services, service definition and standards, and in the policy maintenance of records of services provided. Those are places that as a day hab or behavior support provider, you can find the required elements for those quarterly reports. And providers can post those to in the BEADS portal. But please make sure that if you're a provider of these services that you are completing those reports and getting them into the BEADS portal. Okay, so moving to our questions from February. Okay, so we received a question that I'm looking at some context here. So the question is a visit required to obtain a signature for the choice list, assuming email isn't always an option if an individual calls in with a request? So I am not completely sure if this is a question, who submitted this question. So at the answer is that a visit isn't necessarily required, but the individual or legal rep must indicate their choice of provider on the choice or pick list, and their signature must be obtained. So you can be creative in how to get that signature in terms of, is it mailing it? Is it emailing it? It says email isn't always an option. Is it getting the signature when you're out doing a visit? It could be any of those things, right? But the signature is required on the choice list. We cannot, during COVID, we did accept verbal and ask case managers to document that on the choice list, but we are way past that now, thank goodness, and do require that signature. So realize there could be a little bit of a delay getting that, but would encourage you to think creatively on how to potentially get those signatures for the individual or the legal rep. Choice is a cornerstone, as you all know, of HCBS. And we need, as a state, as a system, to be able to demonstrate that people were offered choice and that they made their choice as well. So those choice lists or pick lists is one of the ways, and the primary way, that we ensure documentation of choice of providers of services. The next question asks if the entire choice list or pick list has to be uploaded or just the signature page. So, and Heather can jump in and correct me if I misspeak about the BEADS portal, but I believe with the BEADS portal, we expect, I believe, the entire document to be uploaded with the choice indicated and the signature. For the pick list that is generated out of CAMS, we understand that that is a much lengthier document, and that it takes a lot of time to load what I've been told could be upwards of 50 pages. So we are, for the pick list generated from CAMS, at a minimum, we need the page where the person has marked their choice and a signature of the individual or legal rep in the uploaded document. I would also note that it is important for case managers, when they offer that choice and they obtain that choice list, to note in their case notes that they provided the pick list or choice list and the individuals made a choice or something along those lines, and then load at least that page with the chosen provider and a page with a signature. We recognize that particular pick list is quite lengthy at times. So those were very good questions that we had last month. All right, next slide. Oh, this is the call for webinar topics. So again, if you have ideas for topics, please, you can put those in the chat. You can email topic ideas at BEADS Provider Services, any of those items. So now I'm going to look at some of the questions we've been receiving. I'm going to start at the top because that's easiest. We have a question about the entire document is sometimes too large. The current pack choice list. Oh, 67 pages just from the portal. Okay. So,
so Holly,
yes.
I'll jump in here real quick.
Thank you.
So
Please
for for the FSW and CIH, the choice list that comes out of there, I believe there's on each page at the bottom is a place for signature. So you don't have to upload the entire document. You just need to make sure that that page that has the choice indicated in their appropriate signatures are uploaded in the portal.
Thank you for that clarification, Heather. I have been working in CAM so much, I had forgotten that. So yes, just that page.
And so, Holly, I will highlight a couple of questions for you to make it a little easier. There's a number of questions around the amount of time that it is taking to complete service plan reviews right now. And so just want to know if you want to address that.
Sure. We know that there is a wait to get those service plans back. And we are working diligently. We have multiple staff working on those reviews, but as you all know, we get a large volume, and I'm sure you have some idea of that. But statewide, we get a huge volume, and we are working through those as quickly as we possibly can. One of the things that we have heard is, like on annuals, for example, that if the annual is waiting for our review, that people are not getting services. That should not happen. And I can't stress that enough. There are extension plans in the system that frankly have been in place long before CAMS and the BEADS portal to ensure that doesn't occur. That if there is some sort of a holdup on a review of an annual, for example, and whether that holdup is whatever stop that holdup is at, whether that's at a case manager who inadvertently missed submission, or if it was state because we hadn't completed a review, that extension process has been in place for years, and individuals should not lose services or see a gap in services for that. That's the whole point of the extension and the resulting notice of action or service authorization. So I understand sometimes when someone's adding a service, there may be a delay in getting that service added. I see a question about pest control. As case managers, I think that, and we have talked about this since, gosh, I guess it's been almost a year, when we started reviewing more plans, right, and everything wasn't auto approved, that timeline shifted. Auto approvals happen very fast. Clearly, when humans have to put eyes on plans, that is not as fast. So as you add something, for example, the pest control, know that there needs to be some time for us to approve it. So adding it for a start date of April 1, if you're putting it on in mid-March, may not happen, right? So feel free to give us a little bit of time when you add a service, if that is an option in that situation.
Holly, there was also a question regarding wanting an update on the health and wellness amendments.
Oh, okay. So the health and wellness, thank you, Heather. The health and wellness pathways and traumatic brain injury waivers are currently at CMS being reviewed. Those amendments include the launch of the level of care assessment representative. So those are at CMS with a planned effective date of July 1. We don't know for sure when we will get those back from CMS, but we think it could be, in June. I do see a question, Heather, while you're sorting through. I do see one in CAMS, the ability to create a choice list is not available. How can I give individuals a new choice list? I'm not sure the choice list. I am not aware of CAMS not having a pick list available. So if that person can put in the Q&A, what they're trying to get out of CAMS that sounds like it may not be working, we will take a look at that. I see a comment, and Heather, just interrupt me if you're catching something I'm not, about the pick list in the portal, and anxious to kind of see what that might look like. So we could potentially maybe add that into a future webinar. I know case managers on the health and wellness and TBI will be getting training on the BEADS portal in June. But maybe we could start to preview some of those things so you can kind of get a look at what things might look like. I see a question, should the PCISP be finalized prior to the agreed upon date for a health and wellness to family support waiver transition, or should a Jira be submitted to request that the plan year PCISP start date get changed? So that's a great question. And I think actually, Kelly, I think we'll take that back and respond to that. I want to make sure that we're giving you the best answer. And given that we've been talking about Jira tickets, let us take that back, and we will either we will address it in the next webinar. If you need an answer sooner than that because you're working on a transition, shoot us an email at BEADS Help. And we'll get that to you sooner. But I think that's a really great question that we can include in our next webinar too. Thank you for that. I see a question about a centralized contact in BEADS to facilitate communication between the health and wellness and the family support waiver. And it used to be Felicia at BEADS. I'm smiling because I've worked with Felicia for years. It's not her. She is our district manager down in our BEADS District 8. She's a great contact, but we can provide that information. It's actually Amy Rapp who will help facilitate that as needed. Yes, Heather.
Yeah. So Holly, I answered that question. I think what we would want is the AAAs to work with the BEADS district offices to ensure that that is happening. But Amy Rapp is our central office staff member who oversees those transitions to ensure that they are occurring without a gap in services. And so if you're running into issues, please feel free to reach out to her. But our BEADS district offices should also be able to help kind of facilitate some of that.
Thank you, Heather. Now I'm just going to be quiet and let you tell me what to answer because I did not catch it.
I think we've gotten through all of them to the best of my ability of what I've been able to look through here. And I think it is one of those, there's a couple of questions around the chat and loss of nursing facility level of care, but if you want to try to address those are fine, but I did share Kara's email address.
Awesome. No, I think that's perfect. I guess the one other thing that I do want to mention, because there are a number of comments about the service plan reviews. So again, we know there's a delay in getting all of those reviewed because we get a very large volume. We are open to, if you want to put in chat your suggestions, that is fine. I think there is an understanding that we need to review service plans to ensure that individuals are getting the services and supports that is commensurate with their level of need and that meet the service definitions. So as our partners, case managers and providers, those plan reviews can go a little quicker if you all are asking those questions when you're working on those plans, right? Are the services commensurate with the level of need, and are the services meeting the service definition? So, that can help as we go to review plans as well, and can likely reduce some of the time that takes to review them. So, if there's ways we can support you in doing that, let us know. We're happy to do that. But please know we are always looking for ways to be more efficient and to be able to turn things around more quickly. All right. I see some ideas for future topics, so thank you for that. We appreciate that. All right. So I want to thank you all for all the questions and comments. We appreciate your sharing some of your day with us. We know how busy you are, but we also appreciate the interaction, and look forward to future work with you. And I just saw pick lists have not been available in CAMS for some time now. So we're going to dig into that. Thank you for clarifying that, because I feel like I just ran one the other day. So anyway, thank you so much for your time. We appreciate the feedback, and hope you have a good rest of your week.